In today's Get Healthy, if you've gone through menopause, you might have noticed some insomnia, maybe some weight gain, and you know what? They are totally common.
Is that just pregnancy? I'm in a kid, I feel like I'm already there.
So apparently there are a few causes though. Joining us now with how to deal with both of them, Dr. Karen Adams, an OBGYN with specialty in perimenopausal and menopausal women, as well as women's sexual health. Thank you so much.
Yes, and you guys are both with OHSU Women's Health, and Dr. Nicole Serino is a psychiatrist with focus on women's mental and sexual health issues. You guys see patients going through menopause. I'm not there yet, but I'm going to be there. Right. Today, this is a recurring segment, so thank you guys, ladies, for coming back. Today, we're going to talk about first, insomnia. What happens during menopause that makes you can't sleep?
So that is phenomenally common in midlife. So about 50% of women 45 and older report sleep disturbance. Can you believe that? That is a huge number. Yeah. It's a huge number. And so what we want to do as physicians, Dr. Serino and I run the Menopause and Sexual Medicine program in the Center for Women's Health, so we collaborate together on most of these patients. And the first thing we want to do is make sure they don't have medical conditions that we need to deal with, restless leg syndrome or sleep apnea or depression. And that those sorts of things can really cause sleep disturbance. But even outside of those things, a lot of women just have a hard time sleeping.
Is it the hormones that are, I mean, kind of going wacky?
It can be hormones. If you're night sweating and you're kicking off the covers 4 times a night and putting the covers on and off, that can be sleep disturbance. But, you know, some people just have that anyway. Almost 50% of us do.
Well, how long does that last? I mean, how long does that last for, and how much sleep deprivation are we talking? I mean,
right.
I think our sleep changes as we get older, and so we typically don't reach stage 4 or deep sleep the older that we get. Some of our melatonin goes down as we age, so we need less sleep as we get older, and that can be a really big change for people. So there's some things that we can do to kind of preserve our sleep and feel the most rested. We talked about some people will choose to do over-the-counter medications. Some people will choose prescription medicines. There's a class of medicines like sedative hypnotics, like Ambien. Some people will choose to use antidepressants. But
there's a lot of side effects with that stuff. But it can really help some people.
And we have a common type of therapy for insomnia. It's called cognitive behavior therapy for insomnia. And this has a lot of research that shows that it can be more helpful and less side effects than the medicines.
Gotcha. Well, another thing that we have been talking about, or that we are just going to want to talk about, is weight gain that a lot of women will
experience. Deal with not sleeping, but I don't want to gain weight. What happens with that?
Isn't that interesting that if you are having difficulty sleeping, it's harder to maintain and lose weight?
That makes sense.
It really is. And insomnia really brings all kinds of symptoms, as well as weight gain. You know, brain fog, that mood issues, you know. So one of my patients actually runs a dementia clinic, and she says the first thing we do when we're trying to sort out if people have dementia is we get them a good night's sleep, because a good night's sleep makes a huge difference for how well you function during the day, including, you know, issues with maintaining weight. So,
and also, I mean, when you kind of get to menopausal age, I mean, things start to hurt, you know, like your joints start to hurt, and so you might not be as active as you used to be.
Right. So there's this whole thing called sleep hygiene, which is all about, you know, there's the medication and the things that Dr. Serino was talking about, but there's also things like, you know, turn off your computer an hour before you go to bed.
Don't look at your phone.
Don't put your phone by, you know, if your alarm is on your phone and you pick up your phone to turn off the alarm, how many people have done a work email while they're laying in bed?
Me?
Me?
You don't? Good for you.
Not a good idea. Not a good idea. Don't ever hit send when you're laying in bed. Not a good thing. And so those kinds of things, like don't eat or drink a lot before you go to bed. Turn off the computer. Don't put a computer or a TV in your bedroom. Have blackout curtains. Make it dark. You know, have a little hand alarm clock that goes around, and you just turn it off.
These are all just good things for everybody.
Right.
Absolutely. Menopause to know that.
And then daytime exercise and, you know, maintaining a healthy diet and managing your weight also really helps.
Thank you so much for the tips, and you know, I feel like I can use this knowledge already. Thank you.
Yeah, you guys are a little young for us.
Well, it's coming. It's coming.
It's going to be there before I know it. All right, doctors, thank you so much. We will see you next time.